Hello, hello. If you're just joining us, go ahead and put the organization you represent and the county you serve or counties. And then let us know if it's snowing. Sounds like it's snowing in Indiana and parts of the state as well as Iowa. So Jody and I are located in Iowa. So that's why we always ask these questions.
My son this morning looked out the window and said, "It's snowing." And I said, "Are you excited?" And he said, "No." And I was like, I feel you. Not quite ready for the snow, although it is really pretty.
It is pretty. My 4-year-old was ecstatic and wanted to go outside right away. We had to get
Yeah,
snow boots on and his gloves, and then he wanted to go touch it. And then he threw a fit when we had to go to daycare because he just wanted to play outside.
sounds about right. Yeah.
So yes, I promised him after school today, after daycare, we'd play outside, but I'm already regretting my words there. All right,
Maybe.
everybody.
Maybe next
Yeah,
week.
maybe. Maybe it'll warm up or something and melt before then. Hi, everybody. Thanks for joining us today. We're going to go ahead and get started because we have a lot to cover and I want to be cognizant of everybody's time. Thanks for sharing your lunch with us today. Jody and I are super excited to be here with you all. A couple housekeeping things. This is being recorded. So after the webinar, either today or tomorrow, you'll get an email regarding the recording. So you can share it with your team. You'll get a PDF of the slide deck and a couple other links that we'll talk about today. And then the other thing is you're automatically muted. Your cameras are off. So feel free to ask questions in the chat or the Q&A as we go. Jody and I will answer questions at the end of the presentation, but I don't want you to lose those questions. So go ahead and answer, put them in as we go, and we'll answer them at the end. And then, yes, continue to tell us the organization you represent today and which counties you serve. And we'll go ahead and get started with that. First, a really big shout out and thank you to Anthem Indiana Medicaid and IMHC, Indiana Minority Health Coalition. It's because of a partnership with them that we are here, that we are giving you this presentation, giving you this webinar, these trainings, these tools to be able to talk about stillbirth and stillbirth prevention with your expectant parents. So we have free materials that you can access. We have webinars like this. We have online CE trainings. There's just so much. And it's really thanks to this wonderful partnership with Anthem and IMHC. So we can't say enough great things about them. As I mentioned earlier, my name is Megan Ockett. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks. I have been with the organization for about 3 years. My background is in public health. I've been in public health for about 15 years. And I am very passionate about maternal child health, but also systems level change. So how can you take what you learned today and integrate it into your workflow, whether you're a home visitor, whether you're a Head Start or a Healthy Start or a nurse or dentist, you can take what you learned today and integrate it into your workflow. And we're here today to give you the tools and resources to be able to do just that. So I'd love for Jody to introduce herself as well. Jody.
Yeah, thanks, Megan. My name is Jody Long, and I am serving as the first ever Health Equity Director for Healthy Birthday. I have a background in TV broadcasting. I was a news anchor for 10 years, just left that career field to join the team at Healthy Birthday just about a month ago. So I'm still learning kind of the ins and outs of how this organization is ran. But during my time as a journalist, I reported on several stories of Black maternal health specifically, and that kind of drove my passion into that. So I am eager to get to work in terms of tackling the racial disparities that persist in stillbirth outcomes and strategizing ways to further reach marginalized communities. So thank you once again for joining us, and let's go ahead and get it. Oops, I muted. Didn't mean to do that. Meant to mute my video instead. All right, this video from Good Morning America was a story that aired several years ago after the launch of Count the Kicks in 2008. And this is a little bit more about who Count the Kicks is and what we do.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
That story, no matter how many times you've seen it, it never gets old. And after that story aired, we found that other babies had been saved due to that story airing. And so we know that word travels fast and people are talking about our app. So our Count the Kicks campaign, what is it? Well, it began when 5 Iowa moms endured the heartache of losing their daughters to stillbirth or infant death in the early 2000s. Then at that moment, those women decided to turn their grief into stillbirth prevention efforts to keep other families from facing the same pain of losing a baby. The Count the Kicks app and campaign is our evidence-based stillbirth prevention public health campaign that educates expectant parents on the importance of tracking fetal movement in the 3rd trimester. Our app is an early warning system providing expectant parents with the data that empowers them to speak up to their providers if there is any concern at all. Now, of course, stillbirth is one of those things that, people don't enjoy talking about, but we have to talk about it. You'll notice that when you look at our materials, they're bright, they're colorful, that yellow really catches your eye, educating expectant parents on the importance of tracking fetal movement. We do have a mobile app as well as paper charts on our website for those who don't have access to a mobile device or struggle with access to the internet. And we know that 1 in 3 at-risk babies can be saved simply just by teaching expectant parents how to use our free Count the Kicks app every day in the 3rd trimester. We do have proof that it is a highly effective campaign because we've seen that same reduction in stillbirth rates here in Iowa through the implementation of Count the Kicks. Let's take a look at some of the definitions and stats next. Just to make sure we're all on the same page when it comes to the language that will be used throughout this presentation, a miscarriage is defined as the loss of a baby before the 20th week of pregnancy. As for the term stillbirth, a stillbirth is the loss of a baby after 20 weeks of pregnancy, after the key word here. Stillbirth is further classified as either early, late, or term. An early stillbirth is a fetal death happening between weeks 20 and 27 of pregnancy. A late stillbirth happens between 28 and the 36th week of pregnancy. And a term stillbirth is when the fetal death happens after 37 weeks or more. On average, this number is startling. 23,500 babies are born still every year in the US. That's according to the CDC. Another really important term to know here too is infant mortality. That is the death of an infant before their first birthday. On average, every year, around 22,000 infants die in the US. So let's talk about some of the numbers here that are important to recognize. We are first going to look at the national stillbirth rate, then we'll look at the rates there in Indiana where you guys are at, including St. Joseph County, which is where our first partnership began. So nationally, 1 in every 169 pregnancies end in stillbirth, 1 in 169. But there are racial disparities that persist in this. 1 in 96 Black pregnancies will end in stillbirth. That number is a little bit higher for the from expectant parents who are Hispanic. 1 in 205 Hispanic pregnancies will end in stillbirth. That number is 1 in 127 Indigenous pregnancies will end in stillbirth. As for white expectant numbers, that's 1 in every 211 pregnancies. For Asian pregnancies, it is 1 in 254 and 1 in 94 for Native, Hawaiian, and Pacific Islander pregnancies. Families are 10 times more likely to lose a baby to stillbirth rather than SIDS. And that's really important to point out because we have often heard of the Safe Sleep campaign, Back is Best, and that being kind of an indicator that, hey, your baby could lose its life due to a sudden infant death syndrome. But still, everybody's talking about that, but not enough people are talking about how stillbirth is still far more deadly for our babies. If we take a look at the data in your state of Indiana, we are losing about 6 babies per 1,000 live births. So that means in the state of Indiana, we're losing roughly around 502 babies every single year to stillbirth. If we look at that over a 5-year period, that's over 2,500 babies that never make it through the birth experience and 5,000 parents who leave the hospital without their baby. And keep in mind, those numbers do not include siblings, other family members, or friends who were impacted by the loss of a baby to stillbirth. Now, due to our partnership with St. Joseph County FEMUR, we were able to gather some race data in all of this. We're working to find fetal death data by race statewide currently, but until we do that, we wanted to share the information that we do have already in hand. We have been working really close with the St. Joseph County Fetal Infant Mortality Review Board, and they've shared the following data. So this data is from 2017 through 2019, and you can see that the fetal death breakdown by race is this. 9 Black babies are lost per 1,000 live births, and that is significantly higher. Indiana is losing 9 babies per 1,000 live births, and that's almost double the number of white expectant parents. We can talk about that in just a bit. For Hispanic expectant parents, that number decreases to 5. And for white expectant parents that are in Indiana, the state average is 5.6, so about 6. If we had to make an educated guess in all this, most likely that number would be replicated and represented statewide. As I shared on the previous slide, we do believe that 1 in 3 at-risk babies can be saved through statewide implementation of our Count the Kicks campaign. If we replicate Count the Kicks in your state of Indiana, we have the potential to save 161 babies from preventable stillbirths every year. We can do this. So here is what Iowa shows for the life of our campaign, which is where Healthy Birthday was founded and where Megan and I work out of. The red line at the top of your screen here and in the graph represents the national stillbirth rate. The dots in the trend line beneath it is our Iowa rate, starting in 2003, going all the way through 2020. About a third of the way through the graph there, you can see the blue dot at its highest is the year when Count the Kicks began in 2008. You can see the trend line from there goes down. The CDC has not released numbers from 2018 for the US just yet, so that's why the national data is stopping sooner than the Iowa data beneath it, just so you know. But one important note is that the majority of the US has remained fairly stagnant, where Iowa's rate has steadily decreased. Now, of course, there's going to be some years where it fluctuates, and it's important to look at data yearly and even on averages. And of course, there are a number of factors that could lead into an increase or decrease in a state's stillbirth rate. But it's important to note that here in Iowa, is that when risk factors like smoking or the obesity rate have increased during this time frame, our stillbirth rate actually still saw a steady decline while the rest of the country remained pretty stagnant. Pretty impressive, right? The 2020 preliminary Iowa stillbirth rate is 4 fetal deaths per 1,000 live births. That is the second lowest Iowa stillbirth rate on record after 2018 and is actually one of the lowest in the US. All right, so let's circle back to the topic of racial disparities. I mentioned earlier how they do have an impact here in our stillbirth numbers that we are finding in states and nationwide. Research backs this up and shows that race, there are some contributing factors to these racial disparities. But please note that Healthy Birthday has reviewed research articles, and these points have come from various articles that we would be more than happy to share with you at the end of the presentation if you are all interested. So let's kind of break this down. Researchers point to a number of things following the causes for disparities. And one of those things is systemic racism. That probably isn't something that surprises you and is definitely something that ties into the racial disparities that persist in stillbirth. But also toxic stress. It's a real thing. Research shows that years of being treated unequally or unfairly as a Black expectant parent in this country have led to issues for Black expectant parents. Another term that you may not be familiar with is the term epigenetics. That is the study of how your behaviors and your environment can actually cause changes in the way that your genes work. Now, unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they actually can change how your body reads that DNA sequence. Really interesting. One of the other things too is a predisposition to certain conditions that may lead to stillbirth, like gestational diabetes and preeclampsia. Now, as a Black woman myself who just gave birth 4 months ago, I suffered from severe postpartum preeclampsia, and that certainly was a very scary situation. Thankfully, my baby girl got here safely. But all of that is linked to maternal stress. Experts say that Black women are less likely than other races to receive early treatment for these conditions. A few other things that contribute to racial disparities, of course, access to healthcare and socioeconomic barriers. But this is an important thing to take home. Research shows that education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. Let that sink in. So with all this information now in hand, you're probably wondering, what is Count the Kicks doing to reduce racial disparities? Well, we are putting in the work. We are making sure to work within the marginalized areas by improving programming based on the lived experiences shared with us by women of color. And as we learn more about these issues and barriers that they face, we are looking to identify solutions and work with our partners on implementation. We're also doing our best to meet parents to be where they are by putting our efforts in areas outside of the typical healthcare setting, like reaching into faith-based practices, churches, and things like that. Our Count the Kicks app is also offered now in 16 different languages. Our materials reflect the diverse background of expectant parents, and we're really hoping to reach those in those areas by including more diversity in our printed materials, videos, and internet presence. The organization has also created a health equity team made up of myself as the health equity director, and we also have a health equity coordinator. Our job really is to strategize and implement ways we can better reach those who are most impacted by stillbirth, but also to review our programming, our marketing materials, social media, just to make sure that things are culturally competent and inclusive. We're also always looking for funding opportunities to reduce racial disparities that persist in stillbirth. And if you're wondering, one of the ways we we utilize funding is we translate our app and brochures to meet the needs of those we're looking to reach. So we offer them in other languages. But I think you can go ahead and change the slide.
Thanks, Jody. That was a lot of great information. And now we're going to switch a little bit. And we know about the data. She told you about the race disparities that exist and persist. But let's talk about how this is evidence-based and the research behind the campaign. It's always a top question that we receive in these presentations. So what you're looking at on your screen right now is a quote from Dr. Ruth Fretz, and she is highlighted here because she is one of the authors from a research study that I highly recommend you take just a couple minutes. It should take no more than 10 minutes to read. It's actually quite short for a study. But the reason that we highlight it is the fact because Dr. Ruth Fretz was part of a research team out of Norway that did research back in the early 2000s, 2007, 2006, that looked at a program educating expectant parents in Norway about the importance of tracking fetal movement in the third trimester. And within this study, this cohort of women that were educated on tracking their baby's movements, there was a 30% reduction in the number of stillbirths. And so what happened was some of our founders, those 5 Central Iowa women that all experienced the heartache and tragedy of stillbirth or infant loss, some of our founders were at a conference where they heard Dr. Ruth Fretz and some other researchers talk about this study. And so hearing this study, the founders, these women came back and they said, that's awesome. Like, we can do that. We can implement a kick counting campaign that empowers people. It's bright, it's colorful. It makes it so providers and those working with expectant parents can easily talk about stillbirth and stillbirth prevention, but also it educates and informs expectant parents on the importance of this. This is a non-invasive, low-cost way to check on baby. So that's what they did. They came back to Iowa. They worked with Iowa Department of Public Health, and they looked at other research, and they created what we all know today and you know as Count the Kicks. So Dr. Ruth Fretz, who now sits on our medical advisory board, she stated that tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern, and that's key. We're going to talk about that word normal in just a little bit, starting at 28 weeks, and to speak up if they notice a change. I think another top question that we get a lot is, wait a minute, if I'm going to do this and I'm going to talk to my patients about this, am I just going to get an increase of calls? Am I just going to get people coming into my office because they're anxious and they're worried? And I understand your concern. I think as humans, we kind of go to that almost like extreme worst case possibility. And I'm here to tell you that that doesn't happen. Kick counting does not increase anxiety in most pregnant women. And I'll tell you why in a minute. Here's another study quoted here, and you can see the citation there. It's all on our evidence page on our website. But he says in this study, one potential side effect of routine monitoring of fetal movement could be an increase of prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. On top of that study and others, we have done our own study with the Des Moines University and the Harkin Institute, who looked at thousands of our app users and found that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because what happens is now, using the app or understanding what's normal for your baby in terms of movement, you now have a highly educated individual that has data in their hands, at their fingertips, if they're using the app, to say, I know what's normal for my baby. This is not normal. And they have a graph to back it up that they can share with their provider, and they feel confident when and if they need to go in and be looked at. I think there's other added benefits that people don't always consider or think about. So reduction of preterm birth rate, fetal growth restrictions are identified earlier. We also know that women who have stillbirths are substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. I think there's that idea that we're going to talk to patients about this and we're going to have automatic emergency C-sections. And that doesn't happen either. In Iowa, our C-section rate has not increased. In fact, it's decreased. And that's also in conjunction with our AIM and our bundles and things like that. But even before AIM, our C-section has not increased, our C-section rate. But I think what's important to know is that this is a way to check on baby, right? When you have somebody that has reduced fetal movement or change in their baby's movements, they come in, they get checked out, they do an NST, maybe a biophysical. 9 times out of 10, hopefully everything's okay and everything's good with mom, everything's good with baby. We want to make sure that we're just catching that one time where something might not be okay. I talked briefly about the connection between stillbirth and maternal mortality. You're 4 times more likely to die if you have a stillbirth. So we have a white paper that was released earlier this year that you can also access on our website, and we will send it out afterwards in our email. But this white paper highlights the facts around this, as well as talking about real life stories of individuals using our app and using our tools and saving not just their baby's life, but their life as well. And so we do have a way that can really bridge that gap that can prevent preventable stillbirths and hopefully also prevent maternal mortality and morbidity from happening. So why is this so important? Movement is a very important way a baby communicates before birth. And we know, and what research shows, is that a change in a baby's movement can be an early sign of distress. Sometimes it's the only warning sign that a baby may give when there's a problem. So when do I want you to start doing this? When should you start talking about this? Whether you're a home visitor, you're a nurse, you're an OB, you're a doula, I want you to start talking about this at 28 weeks, so right at the beginning of their 3rd trimester. If you know they're high risk, start earlier, around 26 weeks. This is when research has shown that baby has really established that consistent pattern that we can feel and track. The other thing I want you to keep in mind, remember I said I'm really passionate about that systems level change. So if you are thinking through your flow and what you do day in and day out and how you interact with people and your expectant parents, maybe you don't always see them weekly or every other week to catch them at that 28 weeks. Maybe you see them at 22 weeks and you're not going to see them again until 32 weeks. Absolutely talk to them about this at 22 weeks and say, hey, have you heard about this? I'm not going to see you when you hit your 3rd trimester until later. I want to give you this brochure. Download the app when you get to your 3rd trimester, and then I'd love to see all the data that you've had since then. So again, super simple, easy to include, and ways to ask and talk about it no matter what time you see your expectant parents during their gestational age. When you are talking about it, really make sure that you're sharing what is a kick, right? I mean, we're called Count the Kicks, but it's more than just a kick, right? It's a roll, it's a jab, it's a push, it's a body roll, it's anything except hiccups, because hiccups are involuntary. And those are, to tell the difference, if you've never been pregnant before, some people would say a hiccup would be almost like a very rhythmic, a consistent pattern consistently for a short amount of time. That would be a hiccup. So now, one of our favorite parts of the presentation, and if you've been in this presentation before, I'm excited because we have a couple new updates. So there are a couple new features that we're going to highlight today, but if you've never been in this presentation, what we like to do here is ask you to multitask. Pull out your phones and go into your app store and search for Count the Kicks. Go and download it. It's completely free. And we want you to do this for a number of reasons. One is because you can see how easy it is to use. But 2, now you have an opportunity when you're talking to your expectant parents, you could just pull out your phone and say, look, I've already downloaded it. Let's go through this and set it up on your phone. Let's see how easy it is to use. So a couple features that I want to highlight and how it works is when you are talking to your expectant parents and we want them to count daily. So you're going to say, I want you to choose a time that your baby is most active, whether that's 2 o'clock in the afternoon, maybe it's 6 o'clock before everybody eats, because this is the only time I have to sit down while something's in the oven. Whatever time of day it is, I want them to choose, and I want them to stick to around that same time, because that's when they're going to really understand and get that trend of how often their baby's been moving during that time. That's where we get that normal movement pattern come in. So when they choose that time and they're doing that daily, all they do is they sit down, they focus on baby. This is where that bonding comes in. This is where they could include significant others and siblings. They could read a book. They could, come put your hand on mommy's belly while we count your baby brother's movements, that type of thing. So all they do is they hit that footprint that you see on your screen there on the left-hand side every time they feel a movement, and they tap that footprint and a timer goes all the way until they get to 10. And then what happens when they get to 10 movements, they get another graph that says almost done, which you see on the right-hand side of your screen. It says, please fill out the following fields to finalize your kick session. And this is newer. This is the movement strength. Research shows that not only should we be paying attention to how long it takes baby to get to 10 movements, but also the strength of those movements. So we want expectant parents to use this app to track how long, but also to watch the strength. If you think back to that video of Ruby, baby Ruby and her mom, when her mom says her movements just felt weaker, they felt softer. So that's what we're trying to track here. And we added this to the app last year in conjunction with researchers and providers to make it as easy as possible to be able to count the strength during that session. So users have the opportunity to basically choose 1 through 5. Fluttery to fierce. So the main thing here is that we really don't want that strength to significantly decrease. And what happens then is after they finalize the session, they get a very visual chart. They get that line graph that you see for movement, and then they get a bar chart for strength. So that way they can see, okay, for example, this baby takes around, on average, 15 minutes and 24 seconds to get to 10 movements. Let's say one day I'm counting and it takes an hour and 15 minutes. What happens to that graph is it shoots up, it spikes up, indicating to me as a user to say, that's not my baby's normal. My baby's normal for the last 3 weeks of counting around the same time each day has been around 15 minutes. So I'm going to call my provider, or if it's after hours, I'm going to go into labor and delivery, OBED, and get checked out just to make sure everything's okay. It's as simple as that. So it's very visual. A couple other features that we wanted to highlight is, like Jody has mentioned, the app is in 16 languages now. We just added 2 more languages. So it's in Amharic, Arabic, Burmese, Chinese, Dari, English, French, Haitian Creole, Hindi, Marshallese, Russian, Spanish, Swahili, and Vietnamese. That was really fast, but we'll send that out. But it's also now in Portuguese and Hebrew. So those are the 16 languages that you can access the app in. If you work in a demographic and population that you don't have any of these materials translated, whether it's the print materials or the app, let us know, because you are the boots on the ground. The reason this is going to be so successful is because you're taking this information to your parents. So if we don't have something you need, we need to know about it. So we can go back to Anthem at IMHC and say, hey, look, this is how we can meet the needs in your community. Let's work together and get this done. Some other great features that I like to highlight is the fact that you can restart a session or delete a kick. So that way, if I'm counting, I'm trying to bond with my, baby and my 3-year-old, 4-year-old, and I'm potty training, which we all know is the worst developmental milestone ever. If I'm potty training and he says he's got to go, I have to stop my kick session and go take him to the potty. Another really key feature here that I want to highlight is the fact that you can set daily reminders within the app. They don't have to go out into their calendar and set a reminder. They can do it internally. They're on the app. So when you're talking to your expectant parents about this, open that section up in the app and say, hey, let's go ahead and set up the daily reminders now so you never forget to count. You can review kick counting history. You can download history and share it. They can print it out and share it with their provider or you as a home visitor or WIC consultant. They can email it to you or text it. You can include significant others. They can log into the account. Excuse me. And then, like I talked about, you can monitor the strength of baby's movements. So it's also on the Apple Watch as well. And new, which hasn't been released yet, but since I have you all here and you're a captive audience, I am excited to share that we will be launching the app on a web-based mobile app. So not mobile, but web-based. So you can actually count at your computer. So if you have individuals where maybe that's the only time they can count is during the day, but they can't take out their phones, but they're at a desk job, or maybe they don't always have access to Wi-Fi? Could they go to a library or a friend's house and count? So be sure to sign up for our newsletter. We will be announcing that within the next couple of weeks of when that's live and active, but it's all connected. You could count on your web, your PC one day, and the next day count on your app, and the next day count on your watch, and it would all be connected. So we're trying to make it as inclusive and user-friendly as possible. Another great feature that I wanted to share was the fact that we added earlier this year a way for users prenatally to get access to services that they need, free and reduced cost services. Maybe they need to find childcare assistance, or maybe they need to find help with housing or diaper banks. All they have to do is to go into the resources section of the app and search for this find help in that section and add their zip code in, and then they'll get shown a list of services. They can filter it by what they need, but close to where they live or work, depending on what zip code. So this is an example for my area. I know there's about 2,000 programs that I could search. This is ever growing. So if you are a program that's not listed, that you do offer free and reduced cost services, you can go in the bottom lower hand corner there that you say, it says suggest program, claim programs, accessibility. Just click on claim programs, and then you can add your own organization, or you can send it to me and I can get it added with our partners at Find Help. So another great resource of how to connect with people prenatally. So the chance of their child experiencing adverse childhood experiences, if we can get them the help they need earlier, that chance of ACEs decreases dramatically. So now let's watch the app in action. I should note that this was shot before we updated the languages. So she will say that the app is in 12 languages, but now you know that it's in 16 languages. But this is a great video to share with your expectant parents. It's already on the app. You can have them watch all the videos. You could put it in your waiting room. There's just lots of different opportunities. So let's watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
All right. Love that information. Loved using the app with both of my kids, and using that new strength feature was an awesome tool to use the second time around. So, okay, so let's talk about stillbirth. We know that it's not something that everyone wants to talk about, but we know it is so important to do. Expectant parents, there are all sorts of things that can happen to their baby that are honestly scary too. Stillbirth being, the scariest, but we talk about the importance of taking, prenatal vitamins, not drinking alcohol, staying away from deli meats and hot dogs, which I craved Costco hot dogs way too much in both of my pregnancies. So moms are able to digest difficult to hear information because parents are already hearing that when they go to their doctor's visit. So this conversation should really be a routine part of your conversation whenever you are interacting with your patients and clients. So we might hear, I don't want to scare expectant parents. Well, as I mentioned, pregnancy is full of risks that we talk to expectant parents about, and stillbirth is just another risk that expectant parents deserve to be educated on. Stillbirth just happens. There's nothing we can do. We have heard from a lot of our lost moms that have received that information from their care providers saying it just happens, but there are warning signs and we know what to look for. That's why it's so crucial that we educate those expecting parents on how to use the app. That warning sign can be a reduce in fetal movement. So it's so important to educate parents on that. In green here, her baby is always active. It's not a concern. Well, really, babies are active until they aren't. Cord and placental accidents can be really sudden. Expectant parents need to know what is normal so that they can report a change to their care provider if they notice a change in their baby's movement. I just had that conversation with a friend who was in her 3rd trimester, and I was trying to, remind her to use the app. And she says, well, my baby is always active. But again, babies are active until they aren't. And lastly, they're almost at their due date. Well, the risk of stillbirth actually increases as the expectant parent nears or exceeds the due date. So again, it's important to start that conversation early and carry it through until that baby is here safely. We must understand that even active babies can experience distress, and sometimes quickly and without any other warning signs. So that's why tracking your baby's movement, once again, every day in that 3rd trimester takes away the guesswork out of knowing if a normally active baby has slowed down. Count the Kicks gives you real data to show your healthcare provider if you have a concern. So talking to expectant parents who have had a stillbirth previously about fetal movement is also just as important. A lot of times we get questions on what to do or what to say when talking about this. And here are a few pointers that we suggest. Follow the same protocol, okay? Read the chart before you enter the patient's room so you don't have to ask them questions that can be painful reminders or even triggering. Since women or expectant parents who have had a stillbirth in the past are more likely to experience another stillbirth, you should begin starting to track their baby's movements at 26 weeks or at 26 weeks versus 28 weeks. So starting that conversation a little bit earlier since that expectant parent is considered high risk. Also, feel free to talk about previous stillbirth and acknowledge that the child was born still. We have heard from lost moms and those who are helping to spread our message throughout this country. They're called our ambassadors. They love it when you refer to their unborn child or their born still child as their name. Many of these, had their nursery already prepared, a name picked out, car seat ready to go. And when you refer to their child by their name, that's really special for them. So ask about the name or gender if you weren't their previous doctor. Also, stay away from medical terms like fetal demise. Those are often words that these expectant parents were faced with in that labor and delivery room. And so staying away from terms like that can be hard for them to hear, triggering as well. Be empathetic and also just be conversational. These are humans, and sometimes the big scary words don't do anything, but kind of remind them of what already happened and what they have gone through and are still going through. Also, ask if anyone has talked about the importance of fetal movement tracking before. We have heard from a lot of parents who have experienced a stillbirth that they were never educated on the importance of tracking fetal movement. So those are some pointers that we suggest to get that conversation started and headed hopefully in a more positive direction. So did you know that health literacy is actually one of the strongest indicators of an individual's health status? One of our goals here today is not only to give you all the tools needed to talk about stillbirth prevention, but also to provide health literacy to your patients and clients. Here are some 5 easy ways you can start doing that today to improve the conversation. The first is to just be equitable. Don't assume. Provide all expectant parents the same information, no matter what they look like, where they're from, what religion they might practice, or their education level. Give each patient the same information and interaction. This one, is pretty simple. Listen and learn, right? Ask open-ended questions about kick counting just to gauge and determine where their patients' feelings and wants are and kind of what they understand. Also, just be clear. We talked about this on the previous slide, to try not to use medical or complex jargon. You all went to school for this and know the more technical terms of things. But expectant parents may, come from just a very normal background, and they might not understand the same terminology in the way that you do. So break it down and use everyday vocabulary. Number 4 is just to be honest. Speak truth while still showing empathy and compassion. It really goes a long way. And lastly, reteach. If the patient you're talking to looks confused or asks questions, don't rush through this portion of the conversation. Take time to clarify and hear them out.
Thanks, Jody. So now Jody and I are going to do a little bit of role playing. I'm going to pretend like I'm the expectant parent and I'm pregnant. I'm in the 3rd trimester, and Jody is going to be my provider. So Jody, I'm in my 3rd trimester, but I don't need to count kicks. I'm not considered high risk. I've had a picture perfect pregnancy.
Okay, yeah, picture perfect pregnancy may be the case, but really all expectant people should be educated on count the kicks and get to know what's normal for their baby. Everything can be fine up until, the day before your due date, but things can change really fast. That's why all expectant people should be educated on count the kicks and to speak up when they notice a change.
Okay, that makes sense. So I've also heard and I've seen on Google when I've been searching that really I just need to focus on making sure my baby gets 10 kicks within 2 hours, right?
Oh yeah, that popular 10 and 2. Well, that's false. Every baby is different, and that is actually an outdated method, if you will. Current research indicates that expectant parents should work to understand what's normal for their baby to reach 10 kicks, and to, of course, document that and speak up if they notice anything different.
Gotcha. So I get to know what's normal for me and my baby.
Mm-hmm.
Ooh, I downloaded an app that I can hear my baby's heartbeat with, I think, like a Doppler. Can I use that?
I know it's so sweet to hear those little heartbeats, but really a change in a baby's heartbeat is actually one of the last things that happens when a baby is in distress. A change in a baby's movement may indicate that there may be potential problems before actual changes in the heart rate are found. Expectant parents should only use a Doppler device under the guidance of their healthcare provider, no matter how tempting it may be to download one of those popular apps.
Gotcha. And just as a side note for everybody too, it's just like if somebody comes in with a change in fetal movement, if you're a clinician and you're their nurse or provider, you don't just use a Doppler device, right? Like you're doing additional tests and things like that to see how baby's doing. So also important to note. Okay, Jody. So I know I'm not supposed to do 10 and 2 or anything like that, but what about my baby hasn't been moving during my normal tracking time. So I'm just going to drink some Mountain Dew and eat a Snickers bar to get baby to move. Okay.
Yeah, well, tempting. And, people, in your tight-knit circle might say, well, lay down and drink a cold glass of water. Well, research has actually moved away from that idea that sugary drinks are a way to get baby to move. Really, though, kick counts are best monitored without interventions like a sugary drink or water. If baby isn't moving like normal, parents should speak up to their provider right away. Really good question, though.
Yeah, because it's just like when you and I are sick. When we're sick, we're just on the couch, we're resting, we're conserving our energy. Same with baby in utero. If something's going on with baby, whether it's an infection, low amniotic fluid, cord issues, they can't move like normal, because we've been tracking and knowing what our normal is, if that changes, we need to be seen right away and get checked out versus trying to force baby to move. Okay, my grandma told me that I was running out of room and that my baby would stop moving and kick less this close to the labor and delivery. Is that true?
Well, Grandma, we love you, but no, the babies don't run out of room at the end of pregnancy, although we may feel like it, right?
Right.
The types of movements may change, though, more jabs, fewer rolls, but babies should really be moving up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time every day, it should take about the same number of times to feel the baby's movements.
Perfect. Oops, my little thing there goes. Okay, I went to labor and delivery triage 3 times when I was pregnant with my daughter. Do you think that's a good opportunity for them to have information? She's now 7 and she was perfectly healthy and fine. I just had to get checked out for a couple things. But I did get sent home. Do you think do they just automatically just send you on your way without anything else?
Well, triage is honestly like the perfect place to have this type of information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. This is a great way to let an expectant parent know about the importance of kick counting, since they already were in tune with their body to some degree to come in and get checked out. This is a perfect opportunity to have our Count the Kicks information in this place of labor and delivery triage.
And then finally, I already don't like going to the dentist, so I definitely don't want to go while pregnant because I don't know what could happen to my baby. Like, what if they have to do something and it's not safe for me or baby?
I get that. And even, laying down on your back in an uncomfortable position for, almost an hour might not seem tempting, but you should really go to the dentist when you're pregnant. Good dental health is always important. Pregnancy can increase an expectant parent's risk of dental issues, thus overall health issues. Dental care should be considered as preventative care, not just going when you have something wrong with your teeth. So always important to go get checked out by your dentist.
Thanks, Jody. You're the best doctor. So those are just some myths and misconceptions that you might get as you're talking about this. We're going to be wrapping up here in the next 10 minutes, but I wanted to address a question that just came in really quickly about the reminders, just to make sure we're all on the same page. So yes, you can set daily reminders in the app. You click on the 3 little lines on the left-hand side, and there should be a section that says reminders. So click on there, and then you'd be able to set your reminders. You probably have to be registered and logged in to see that. But go ahead and make sure you can see that before we jump on to today, so we can troubleshoot if need be. Okay, so as we think through, you have the data, you have the research, you know how to talk about this, you know how to talk about myths and misconceptions that may come up. How do you integrate this? Well, it depends on what you do. If you're a home visitor versus an OB versus a nurse versus a WIC consultant. But really, you can integrate this in any of those settings. You can connect in your community. You can have your entire staff trained. Could you include this in a family care plan or an intake form? You ask questions anyways about, their demographics. Are they pregnant? Are they expecting? Are they breastfeeding? All of those questions. Could we ask a question of what trimester are you in? And then flag our account to say, okay, I need to be talking about Count the Kicks when they hit the 3rd trimester. What about the glucose test? If I have any medical providers or clinicians on today in Iowa, or at least for me, I took my glucose test in the office. I had to chug it, that wonderful drink, in front of somebody. They had to watch me, to take my blood, and then I had to sit there for an hour while I waited for my next blood draw on my appointment. What a great opportunity to say, sit here, look at your phone, download this app, read this brochure, and then we'll talk about it. That's a great opening. My favorite option, EMR, EHRs. Can you add a question to your electronic medical records that pops up that says, remind the patient to count their baby's movements? Could you add a message about Count the Kicks for hold, people on hold and things like that? There's just a lot of different ways. I'd be happy to talk to you about it in more detail offline for your specific situation. This is just a quick after visit summary. When we talked about triage needing this information, like I said, I went 3 times with my daughter. I did not have the app at the time when she was born. It came out right after she was born. But I didn't know that 30 minutes, I would track her movements, but I would get it within like 30 minutes, her 10 movements. And I was comparing her to my son, who took 5 minutes or less. So I didn't understand that that was just her normal when I was counting during that time. That was her pattern, right? I didn't understand that. So I went to triage 3 times. That would have been the perfect opportunity after I got checked out. Everything's fine. She was born healthy and 38 weeks, and she's now 7 and feisty. But that would have been awesome to have this discharge paper to say, here's how you count your baby's movements. Here's what you should do. Pick a time, et cetera, et cetera. Don't compare to your previous pregnancies. Don't compare to your friends. And now we're going to wrap up. Jody's going to talk about a couple additional resources.
Yes, friends, we are nearing the end of our presentation. We have filled this presentation with a ton of information, and we cannot wait for you to utilize what you've learned. We would love for you to take advantage of our free Count the Kicks educational materials, thanks to our partnership with Anthem. A big shout out to them. We know that we are all proficient in multitasking. So right now, go ahead and scan this QR code, or pull up your phone, or of course you pull up your phone with your QR code, or rather open up a second tab on your desktop, or if you're like Megan and I, open up your 17th tab and just head over to countthekicks.org, and you can click order materials and fill up that shopping cart. We have promo posters, how-to posters, app reminder cards, and brochures. Take a few minutes to do that while we wrap up our presentation. We are so grateful for you to do that. We also have a continuing ED training that is available to you for free $99. Who doesn't love that? It is worth 2.25 CE credits. You can simply head to this website that you see here on your screen, Save Babies CTK, and use the free code SaveBabies-IN. But there's no need to write that down. We are going to send out that link in the post-webinar email. So if you are interested in that, take advantage of it. It's free. It's about 2 hours or 90 minutes worth of really good information that will help you better understand what all of this is about.
And I'll just say too, that's going to play for a second. If you do go order materials today, like right now, as we're multitasking, you'll be entered to win an option to win another gift card. So again, it's a win-win, right? Like you get free materials and you get entered to win another gift card by doing that. So absolutely take advantage of that. So then, sorry to interrupt. Go ahead, Jody, wrap it up.
No, a really good reminder, as you know, who wants a gift card as we are nearing the holiday season?
No
yes,
kidding.
give them all the free money. All right. Also on our website, we have a parent and provider academy that helps in answering some frequently asked questions. And remember, if they don't have a mobile device, or even have issues with accessing the internet, we do have our kick counting charts in English, Spanish, and Haitian Creole. Just so you know, those are some really good resources that you can hand out there. Also on our website, we have a whole gallery of videos you can watch that help share our story, as well as Baby Safe Story. If you're ever having a down day when you look outside and there's 4 inches of snow on the ground and you think, oh my gosh, I need happiness right now, go read our Baby Safe stories. Once you get into those, you might find yourself reading a whole bunch of them, including an Indiana baby safe. This is Sweet Piper. Her mom shared with us that her OB told her to begin kick counting at 26 weeks as an important way to monitor Piper's health. And so she downloaded the Count the Kicks app and used it to begin tracking twice a day. This mom says that she loved the notifications the app sent to remind her if she ever missed a day, because hello, mom brain is real when you're pregnant. And I swear, even after you've had the baby as well. And we know that and this mother says, we know that if we hadn't had all the tools, intuition, and expertise that day, that the pregnancy could have ended so very differently. As Piper continues to grow and thrive from her premature arrival, we feel so incredibly thankful to have her in our lives, and we pray for the same outcome for others. That was Kendra, who is a resident there in Indiana, and sweet Piper, so fashionable in her headband and swaddle there. We're so thankful for her to have access to that app, and why this was so important. Also, we can save other babies like Piper and even baby Nala. You can watch her video here if we have time.
Perfect. Yeah, we will share her video right now, but feel free, I know we're at time, so feel free to jump off if you do, but we'll stay on to answer questions, and then we'll share this video too afterwards. So let's listen to Nala's story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention to count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life. She can't.
So I just love her story there where she says, go check on your baby. So that's it for us. We're wrapping up. So you become familiar with the app, you order the materials. This takes 3 to 5 minutes. It's not very long to talk about. And you do it every single time you see somebody in the 3rd trimester. Make sure everybody knows about this. How can you integrate this in, you know, include it in your EMRs, EHRs, and remember hours and minutes matter. So if you do have an area that's very rural, making sure that people who have a long drive to their nearest birthing center know that they should go right away versus waiting for the family care clinic to open up. So feel free to follow us, share our social media messaging, sign up for our newsletter. We're happy to answer any questions. I know we went a couple minutes over, so we apologize for that. But like Jody said, it's a lot of great information. You will get sent the recording. You will get sent a PDF of the slides and a couple other links that we talked about today. Happy to stay on, and I'm just going to look at the chat and make sure we didn't miss any questions. We tried to answer them as we went, actually, so hopefully we did. Thanks, Allison. That's awesome. Well, thank you all so much for your time today. And our CEO is actually in Indiana right now. So that's exciting. So thanks, everybody. Enjoy your day and have a great snowy day. We'll stay on for just a couple minutes here.